Welcome to this week's webinar in the Dermapen 4 or DP4 microneedling webinar series. I'm Gregory Zengo. I'm a MD physician based in Georgia. I was originally trained as an OB-GYN and got into aesthetic medicine actually with sclerotherapy, treating spider veins in the legs way back in 2000. Went on ahead and added toxins and fillers and got into some laser and pulse light equipment that eventually, as you can imagine, broke down and required a lot of money, and realized that wasn't the way to go. And I kind of stuck with the skilled procedures that involve injections. In 2008, I founded Practical CME Medical Training because the training options for aesthetic procedures were dismal at the time. And as part of the evolution of Practical CME, we wrote and researched the first ever microneedling and PRP, cosmetic PRP accredited CME training course. And after dozens and dozens of revisions, we went on ahead and broke the microneedling out of the PRP because it is an incredible standalone procedure. And now we're offering that by itself. With Dermapen 4, we have a special version of that course that includes all of the CME accredited content in microneedling, including dozens of clickable links to the medical literature, ways to perform the treatment, patient selection, indications, and what goes on microscopically, so you are well versed in this very important and rigorous procedure that will allow you to then relate that to your patients and hopefully sell more treatments. And it's really important to have CME-backed education. Your medical malpractice carriers, if they don't require it, there's a good chance they will relax your rates if you present to them CME accredited training and something they are covering you on. So definitely investigate that. And this is the most cost-effective way to do that. If you look in the comments, there are a couple of links that you can click on. And DP Derm has specials on the course, so keep an eye on your email for that. You can order the course using the second link there. You can learn more about the course using the first link. So I think microneedling is one of the most exciting procedures around. No, I think it is the most exciting procedure around. And I shared some of that excitement in prior webinars. You can watch the recordings of those. And tonight we're going to take a step back, almost all the way to the beginning. And that is when you meet a patient for the first time and talk about microneedling for the very first time. How do I do it? And I would love to hear your comments along the way. Please type in the comment fields as you go, and I will get to all of your questions and answer them. But this will be a lot more low-key than the prior webinars. So we're going to go over, first, of course, you've got to eliminate non-candidates when you talk to your patients about microneedling, and that's quick and easy because almost everyone who walks in your door is a candidate for microneedling, at least if they're over 21. So then you move to determine the need. And the first thing you want to do is listen to the patient's concerns. And we'll kind of go about how I do that, and then proceed to go through the full face evaluation. Then once you get through that full face evaluation, let the patient know what this is going to take, what the treatment schedule is, and start to discuss some of the serums and the home care that you're going to personally select for them. And the reason why that's so important is because microneedling is one of the most customizable medical procedures there is. It has a ton of indications, and it has a ton of ways that you can do it to customize it for those indications. And by showing the patient that you're going through that thought process and making this treatment just for them and just for their needs is often the thing that will convince them to go on ahead and buy that first package. And then, of course, we'll talk about a very special way that I emphasize the need for continued treatments at regular intervals. Granted, a lot of people want to come in and do one and done things. Now, I don't know what else you do in your practice, but there's not a lot of one and done in this world. Plastic surgery is probably one of them, unless you live in certain cities like Miami or LA, maybe, where it's an ongoing staged thing. But in general, nothing we do is one and done. And I'll explain kind of how I relate that to the patient herself. That's just where we do our hands-on. If you do want hands-on training in anything we teach all over the country. We're looking for faculty and hoping to add more cities as we go. But now let's get on with it. So first, who are the non-candidates? That's people with active infection on their skin. That is especially something that is undiagnosed. It's not that they're not going to be a needling candidate forever, but we need that to clear down and get treated. So they need to work with their dermatologist there. Anyone with active skin cancer, of course, that has to be biopsied. It has to be evaluated. It has to be fully under treatment before you can do needling. You can needle around it. It still, again, doesn't mean that you can't do the case. It's just if you see anything suspicious on that patient's face and they don't have a name for it or they haven't shown it to their dermatologist, get that clearance first. This is rare as well, but anyone who has a history of scarring or keloids from needle sticks, you're probably going to want to do a test area with your microneedling pen first and evaluate that a couple weeks later. FDA indications for microneedling indicate that microneedling is allowable or recommended in people 22 or over. So under age 21 is a relative non-candidate because it is lower than the age limit specified by the FDA. If you choose to use it off-label in someone younger, you certainly can. It's just remember that's a parameter that we sometimes have to follow here. And finally, patients who are currently undergoing a series of chemical peels, especially mid-depth chemical peels, lasers, microdermabrasion, these things are not really synergistic with microneedling. They can get in the way of what we're trying to do. And frankly, I think microneedling is better than all of these things if you select the right depth, the right treatment interval, and the right home care. You can replace all this expensive equipment or these risky, deep procedures like mid-depth chemical peels and get great results. But we don't want that patient sneaking away and trying to do other procedures in between our treatments. That can render our treatments less effective. So once you've eliminated the very few non-candidates, let's get on to the full face evaluation. Of course, the first thing I do is I go and grab my handheld mirror and I say to the patient, what is it about your face that you want to change the most? Because when we look at our face in the mirror, there are areas and aspects that we like, and there are aspects that we don't like. There are aspects of our face that look our age, maybe look younger than our age, and there are aspects of our face that look older than our stated age. And so we want to try to get the patient to open up and tell us what her problem areas are. Because let me tell you, when you can help their most problematic area and you can do it with confidence, they will become a patient for life and you will get them very, very satisfied. So what I want to know is, what are they doing about it? And that's the question I ask. I'm very in your face and very conversational. And I say, okay, that's your worst problem. What are you doing about it? You know, I lapse into my New York accent sometimes, even though I haven't lived there for 30 years. And, you know, what are you doing about it? And a lot of times they say, oh, well, sometimes I'll try this serum and then it runs out and maybe I'll do something else. Other people have a very strict home care regimen, and sometimes that home care regimen is quite involved. So we want to know what they're doing first. The reason is that their home care regimen is going to need to change if we microneedle them. And we've got to make sure they're okay with that change. And that change must occur for the 3 to 4 days post-needling while the channels are open. Because most home care regimens are not compatible with open needling channels. They have things like perfumes and artificial colors and humectants and emollients and things that we don't want to put on needled skin. Remember, if you don't want to inject it into your skin, you don't want to put it topically on needled skin. The FDA on-label indications, which because this is a webinar and I teach CME, we have to mention, are acne scars and fine wrinkles, also body scars, which we're not going to talk about so much tonight. So those are the FDA on-label indications. And of course, there are a tremendous number of off-label indications that work very well, that we have very well-established protocols for time and treatment, and serums available to us for these as well. And they include pigment, general glow, and texture. This is kind of that 10x magnifying mirror appearance of your skin. Do they have scars on their face? And of course, you can bring up body scars as well, because you can use the same microneedling head to treat body scars as an add-on if you wish, after the face treatment is done. Rosacea, active acne, even things like vitiligo have an opportunity window with microneedling. And then finally, scalp therapy. I don't like to call it hair growth, but we can call it scalp therapy, has another indication for this. So there's lots of things we can do, and we can combine multiple different depths and treatment intervals in the same patient if she has multiple concerns. So at that point, I've hopefully got the patient interested, and I tell her that we've got something for these conditions. Now I get into the point of selling the procedure. Now, some people know about microneedling, but they may only think of it as a home roller, something, oh, it's just the channels. I don't know. A lot of patients don't know about the synergy between the channels and the products, but it's natural. That's the bottom line. It's completely natural, and it's gradual. So nobody is going to walk out of your office, go to the grocery store, bump into their best friend, and their best friend says, who the heck just did your blank procedure? It's fairly quiet and gradual, and that's one thing I love about it. Like I always say in my dermal filler class, if you do a case on a patient and someone asks her in the next week, who did your filler? You probably didn't do a very good anatomic job. And the same thing's true with something like this. There's minimal downtime, with the exception of just protecting your face from direct sun. There's minimal discomfort from this procedure if you bring the patient in early enough and work on putting on your topical anesthetic. And the word I love the most is it's customizable, meaning it is customizable in terms of the depth, the interval, the number of passes you make, the aggressiveness of those passes, the serums you use in the middle of the treatment, and the home care regimen. And if right now you are not going through this, you're doing microneedling with somebody else's equipment, and you are not going through this thought process, you're just smearing this tube of glycerin on their face that they give you in the box, and you do the needling at a pre-programmed depth and walk away, you're not getting the full results, because this package, this customizable package, is crucial. And the really cool thing about it is you can change it up. So if pigment is the main issue, and as that clears up, they want to work on fine lines, then you can change the aspects of this regimen to better suit the needs that evolve. And then finally, I like to talk about popularity worldwide. I just got back from Korea, and so I saw a lot of Korean skincare and the emphasis on skincare. And granted, they have a different FDA and all that stuff, but home microneedling rollers are almost as common as a toothbrush there. So, it is a very well-accepted procedure worldwide. This is not something experimental. I've been teaching CME courses in it for 10 years, and it's an incredible standalone procedure. So we've talked in prior weeks about some of the geeky stuff and the molecular stuff and what's in the medical literature. And I kind of read my patient at this point, and if they field any questions about, well, how does just punching holes in the skin work? Or they want to know a little bit more about that, I'll get into it. And of course, our CME course will teach you how to talk to patients about this part, but we can talk about what platelets do, their role in the healing process. We can talk about the immune response that is triggered by making the microneedling channels, and all of this immune response is positive, with except for granulocytes, and those are actually quite minimized. Remember, we also in prior weeks talked about in general the algebra of microneedling. Remember that the healing is always greater than the trauma. As you know, a lot of times trauma to the skin results in a healing that is worse than the trauma itself, especially when a scar is produced or something like that. The cellular function we attain after a series of microneedling treatments is always better than that patient's age baseline, meaning that skin is performing on a molecular level like a younger person's skin. We generate more healthy collagen than scar collagen. That's extremely important when you compare this to heat-based procedures. We get the dermis thicker, and a thicker dermis. Now, you got to be careful with the word thick when you're talking to a patient, because they can think of like the skin on their kneecap as thick. You know, that's not what we're talking about. What we're talking about is a plumpness, a hydrated skin, and an elastic skin as we trigger fibroblasts to make more collagen and elastin. A plumper skin that is more resistant to wrinkling. That's what we're going to achieve. And finally, the best algebra equation of all, the injury channels plus the products give an effect greater than the sum of the two alone. Products alone, channels alone are good, but the combination is a synergistic effect. And that's what I love about this absolutely the most. So then I talk to the patient about the body clock, and I say, okay, what do you want to do about aging? Do you want to slow down the clock? Do you want to stop the clock? Do you want to turn back the clock? Some people, if they want to turn back the clock, I'm like, when's your appointment with plastic surgery? You know, yeah, there's a lot of things we can do with fillers and toxins and other things like that. But that type of patient's probably already had something major done. They're mostly, in any younger group, yeah, you can turn back the clock, but you're looking at a series of treatments and you're looking at a significant amount of time. And I'll show you a visual for that. Do you want to stop the clock? Do you want to slow down the clock? Obviously, it's the easiest and the cheapest and the least amount of treatments to slow down the clock. Requires a little bit more effort to stop the clock, requires more effort to turn it back. We can do all of it, but aging is the ultimate down escalator. And you start as a young person with nice, smooth, uniform, tight skin, and you get older and your skin is affected by gravity and it deflates. Where every other part of your body seems to inflate, the skin deflates. And that's a problem. The skin in the face deflates. So aging is the ultimate down escalator. So what do you want to do about it? Well, if you want to stop the process, you need to start walking the other way. You need to turn around and walk. And if you walk a significant enough speed, you will stay in place. And that is what I mean by trying to stop the clock. You have to move, and you have to constantly move in the right direction to stop the clock. It is an ongoing, consistent effort. Now, if you want to turn back the clock and you want to walk your way back up that escalator, you got to run, and you got to constantly run against that downward flow. So that's what I want to really make sure that I'm conveying to my patients going forward, is that if they put in the effort, I've got the tools to help, but they have got to make sure, they got to decide, do they want to just slow down the descent? Do they want to walk up the escalator fast, or run up the escalator? And then if we get on to the next step, I'll say, okay, your main issue is pigment, but also anti-aging. I've got a number of treatment serums here that I can choose, and I would like to start with my Bright Light, or the MGBL, which is going to focus mostly on pigment, because pigment, although it's very shallow depth and of treatment, but requires treatments more frequently, it needs a lot more treatments to turn off that pigment. It's a process. And so they got to hit their marks. I tell them, look, you got to be prepared to come in every month. This is the serum we're going to use, and this will get you lighter. And then when you get to the point where you're lighter and we've got that under control, I'm going to switch up the serums, and I'm going to go to an HA35 plus and start to work now more on the fine lines and wrinkles. Now, we're working on the fine lines and wrinkles just from the needling channels alone and just from the hyalofuse that's in the bright light, but we're working optimally on pigment. When we switch over to HA35, we're still working on the pigment, but we're working more optimally on wrinkle resistance. So those are some of the beauties of these serums, is that they'll work on everything, but they specialize in something. So expectations. My goal at this point is to get them into a series of treatments. And I usually recommend a series of 4. I don't want someone to do one treatment. I price one treatment so high that I don't want anyone to buy it. But I want to see a commitment to at least 4 treatments. And if they give me 4 treatments, I'll give them visible results. Those treatments are fairly frequent. If it's for active acne, pigment, if it's scalp, every 6 weeks for general anti-aging or wrinkles, and roughly every 8 weeks for scars. So that 4 treatments could take as long as 8 months. And we'll spell that out to the patient so they can think about their schedule going forward. And then, of course, they're going to need to do our home care regimen for 3 to 4 days post-procedure. And by going over their current regimen, I will talk about how they stop those products that they use at home while we do our home care regimen. And then we are not going to judge any improvement until after that package of 4 is done. The other beauty about DP Derm is that you have these nice home care starter kits that I like to give my patients so they can use that in those 3-day windows, and I bundle it into the price of the package. The treatment heads, by the way, if you're paying more than $25 for a treatment head for your microneedling pen, you're paying too much. But the savings I get on the treatment heads by using this equipment allow me to take that money and give them this home care regimen. And so they're getting a much better result. And you've got 4 of these different home care starter packs that you can choose based on, again, the patient's need. And they all have a cleansing step. They all have a treatment step and a correction step and a protection step. So it's a nice way to introduce them to the products and ensure that they get that synergy of results. So that's pretty much how I go from meeting my patient. Maybe they come in for a Botox treatment. Maybe they're in for filler. Maybe they're in for wellness and weight loss, and they've just completed some successful weight loss, and they want to work on they want to work on their appearance now. That's how I go on ahead and approach them and get them sort of plugged in. Now, I'll talk about the one patient, and if you look at me on camera, there is the one patient that's constantly looking in the mirror and doing this, and she's lifting and pushing and saying, oh, I just want to get rid of this. And she's constantly lifting. So what I tell her is basically, look, we're stuck on a planet with gravity, and there's nothing I can do without surgical sutures that is anti-gravity. So if that's their number one issue, then a lot of times what I'll do at that point is I will sit them on my motorized chair and I'll lay them back flat, holding the handheld mirror. And I'll allow them to look at their face in the handheld mirror while they're lying down. Because whatever that eliminates the gravity-related change. So now they can focus better on the pigment, the fine lines, the wrinkles, all the other stuff. And then a lot of times I can get them on board with what they want to improve because they're no longer focusing on the gravitational stuff. So that's just something I like to do, lie them down and get rid of some of the gravity, and that seems to work pretty well. All right, I was going to go look at questions. I saw a question flash up, and I don't see it on my list. So let me see. Chat with everyone. Where did that question go? I might need some help from the bosses here if they can. I saw it flash on the screen about age, what age group worked best, but it didn't appear here on my messages, my in-call.
Yeah, let me jump in real quick, Dr.
Yeah,
Zen, if you don't mind.
thanks, Zach.
Anyone that would like to ask a question, you don't.
Oh, there it
in the
is.
comment
I
section.
clicked
Go
on
to
it.
the Q&A is
Yep.
on the bottom right corner There are 3 shapes. If you click on that, you can answer the Q&A and ask questions there as well.
Great. So Alex typed the question again or repeated it, and I was able to click on it and see it. So in your experience, what age group or demographic group sees the fastest result from microneedling? And so faster results are going to be people that are, let me get my visual. Faster results are going to be people that are closer to the top of the escalator, so to speak. And the reason is they have much more regenerating capabilities. They have, better fibroblasts that are going to respond better, the more production of collagen and elastin. So I would say people with general overall skin, fine lines, wrinkles, 40s and under are going to see things the quickest. Pigment, I generally like to say we have 3 endpoints. We're going to do 3, if possible, 3 packages of 4, with the main endpoint being at 1 year. The medical literature says that, and I think that's true too. And we pass no judgment on how things are going until the 4th treatment of the first package. And usually by then we see some difference on camera shots, or if you use any of the visual imaging software out there, you'll usually see a significant difference, but don't do it every treatment. It's too soon. Surprisingly, one other group that responds pretty quickly is acne scars. And you would think, oh my God, a scar is really difficult. But the little dots and acne scars, mainly because we have such incredible serums with this equipment, and we have such sharp needles, but also a really true depth on this equipment. I've used other equipment. I mean, I've got more microneedling pens in my office than a 16 handicap golfer has putters in his garage. And they weren't right. The depth wasn't right. And a lot of them, I don't know if it's to appease patients and try and make the procedure seem less painful, but a lot of them are under depthed, so to speak. You know, you think you're going at a millimeter and you're not getting it. So the thing I've loved about this pen, especially since I've started using it a year ago, is that I'm really seeing improvement in acne scars by about treatment 3. Now, the improvement's not complete, but it's definitely enough to make them want to continue. And I have seen some people even stop after 4 treatments because they're completely satisfied with their acne scars. So I really like that a lot. So that's 3. To summarize, younger patients, people under 40, I guess anyone younger is younger than me, right? So younger than 40, and acne scars can be really good as well, but pigment is going to be the one that you have to be the most patient with. Janelle asks, how do you feel about offering memberships to drive treatments? And that's a good approach if you have a big menu of services. You know, everyone loves to go to a restaurant with a huge menu, especially if you're a big group, because everyone will have something they want to eat, right? So if you've got a lot of services, memberships like that can be really good. You got to be creative with your marketing with that, but you also have to be careful that you don't underprice it and end up giving too much away with those memberships. So you just have to be careful. If you don't have a big menu of services yet, I would steer you more with microneedling to just packages. And that is, you package a certain number of treatments, you bundle in, 4 of the HA masks, and you bundle in one of those home care kits, and do that for just one set price, no matter what serum you use, no matter what depth you have to go. And that usually works pretty well, and people can budget for that really easily, and it commits them to 4 treatments. The other issue about memberships too is if you're collecting money up front, got to escrow that money. You got to make sure that somehow that is off your books, because you have to deliver on these procedures later. And if half of your procedures are membership based, then you're going to see this big jump in your bank account. But there are going to be days 4 or 5 months down the road where no one buys a new membership, and it seems like everything you're doing is free. So for the perspective of your cash flow, make sure that you escrow that money and don't spend tomorrow's revenue on today's expenses. Janelle also asks, do you do anything with hair restoration and needling? Yeah, I do. And that will be more and we talk about it in the CME course, and we'll probably cover it in another webinar. But it's been well established in the medical literature that microneedling does condition the scalp. It does assist in follicle density, and it does assist in hair density. You've got to go deep, and you've got to do it fairly often and keep it ongoing, and you've got to have the right home care as well. You can't let someone walk out with a scalp full of microneedling channels and then have their scalp dry out because they're not doing any home care with that. This is also an area where PRP synergies are very high. I'm not a big fan of just using PRP with microneedling because it looks cool. I follow the literature, but this is one area in the literature where there is that synergy. So yes, we do it, but remember, you are never going to make a new hairline with needling or PRP. And you're never going to make hair grow out of a bald spot. So if someone has some thinning like I do up here, and you can, or females especially, because they don't have DHT to worry about, dihydrotestosterone, combine that needling with some HA35 serum and the Hyla Active product for home use, and keep a hat on for 3 days after it. Keep that scalp from drying out. Come in every month. I think you can make some nice progress on women with just needling alone. So, all right. Well, we've gone 3 minutes over. I want to thank you all for your questions. Of course, if you have any other questions, you can always let your DP Derm rep know, and they can get them forwarded to me. Otherwise, I will go on ahead and shut down the escalator and wish you all a good night. Wait, there's one more comment. Thank you for joining. I appreciate it. And we will be back in a couple weeks to take this one step further. And we're going to talk about more of the sales approach. And that is, how do you form a package? How do you sell packages? And how do you keep these patients staying on time and getting the absolute best results? All right. Thanks a lot for joining. Have a great night.